am not at all in favor of anything of that. Whatever you do, you need a normal healthy milieu there. Vagina is having a normal dauberline bacilli which is necessary there to keep the ecosystem of the vagina normal, so that the other infectious bacteria come there. Like in the GI tract, you have the normal bacteria so that you don't end up having other infections. Same way, the vagina has a Dudlin bacilla which will prevent you from having the other either candidiasis or other bacterial infections coming there. So, steaming and increasing the temperature in such a way that even the normal bacilli die means you are keeping the vaginal area susceptible to other infections. So, all these things are I think the diseases in waiting. So, we are waiting just for doing all these things, going away from the norm and inviting problems. One of the common reason a girl comes to a gynecologist is white discharge, because there is a lot of myths which go around with white discharge. If they have a backache, it is because of white discharge. They are becoming thinner, it is because of white discharge. The girl is becoming lean and weak because of white discharge. But one thing everyone should understand is it is a normal phenomenon to have a white discharge. There are secretions from the body from every organ. It is like how your eye waters, how a ear secretes, and the mouth waters. Same way, from the vaginal tract, from the cervix, there are secretions which come. There are certain times of your normal cycle where the secretions are more. That is, when you ovulate, you have a white discharge which is thick and which is like a stringy lesion. That is normal white discharge. The same way, just before the period also you can have a white discharge. So, any white discharge which is not foul smelling, not itching, and it can be watery or mucoid is all normal, and these secretions increase whenever there is a sexual arousal in the body. So, these are things which can happen, or in pregnancy it can increase, just after delivery it can increase. These are all the normal physiological white discharge. Then what is the time you should be worried about white discharge and you should meet a gynecologist? Once there is an itching which is associated, or that it is a curdy white in color or greenish or red blood stained, or anything which is having foul smelling, or a different thing which is not from the normal, there is time for you to go and get yourself evaluated, tested and treated accordingly.